When couples are trying to have a baby, everything matters, from medicine to diet to exercise and reducing stress. Tonight, a fertility expert shares some surprising do's and don'ts that may contradict what you've been told before.
With straight arms, reach up overhead, looking up towards the sky.
Erin Haag
And back into your prayer position.
knows yoga, but can't do the poses like she used to.
Press up into up dog.
The reason is obvious.
And I'm 26 weeks.
The road to parenthood hasn't always been joyful for Erin and Eric, her husband of 7 years.
You know, my husband and I are both big overachievers, but the one thing you want more than anything, you can't seem to achieve.
It took them 2.5 years, 2 rounds of in vitro fertilization, and a miscarriage before they had a successful pregnancy.
Prepare is the message.
Dr. Victoria Mazes understands the heartache and anxiety infertile couples go through. She's a women's health expert and author of Be Fruitful.
One of the most important myths, I would say, is that you can wait.
Hollywood may be partially to blame. Dr. Mazes says celebrities who are having babies in their 40s and 50s make it look too easy.
And what's not being said is they're probably using donor eggs.
Dr. Mazes says fertility peaks for women at age 28 and decreases quickly after 35.
So the biological clock is real for women, and it's also real for men, by the way.
Diet plays a big role in fertility.
It turns out anything that bumps up your blood sugar makes it harder for you to conceive.
Eat fish, but avoid the kinds known to contain high levels of mercury.
If you don't eat fish at all, you have children with a lower verbal IQ.
If you like milk, fine. The doctor says just make sure it's whole.
When you drink a skim milk or a low fat, you're drinking a milk that has an altered balance of hormones and altered in a direction that makes it harder to get pregnant.
Avoiding stress is key, but try telling that to a woman who's having a hard time getting pregnant, which brings us back to yoga.
It's a wonderful centering, quieting practice that can definitely be part of a fertility journey for a woman.
And poses, she says, like the butterfly and the half moon, can actually help when you're trying to conceive.
And you can see that it really opens the lower abdomen, it opens the pelvis, and it's a wonderful pose. You can't grip in this either, so it's not a gripping, it's an opening pose for the abdomen. That's fabulous. Thank you.
And deep breath in and blow it out. Okay. You okay?
Dr. Mazes also recommends acupuncture, especially for women undergoing in vitro.
If you do acupuncture at the time of embryo transfer, you are almost twice as likely to have a live birth.
Reaching the arms overhead.
Erin believes all of it helped her and her husband
And this was our last 3D ultrasound. This was at 22 weeks.
conceive their miracle baby.
And you're having a
Girl.
congratulations.
Thank you.
Now, we've been focusing on women, but men, this is about you too. Dr. Mazes says men who take multivitamins are 5 times more likely to impregnate and have a child with their partner. And then there's the biological clock. The doctor says that applies to men too. It's not that men are at a risk of fathering children, but there is a risk of having a child with autism or schizophrenia after the age of 40. Again, the name of the book is Be Fruitful.